to the Doctor is In television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California, on the Central Coast in California. I'm delighted you could join us for this next segment. What I'd like to discuss today in this very important topic is the hard breast implant. More accurately, it's the breast implant that feels hard. And there's a term that we're going to use, I'm going to teach you about today, that I think is very common. It's a very common phenomena, and all women who undergo breast augmentation with breast implants should understand what this term is, and that's called capsular contracture. Let's back up. There are there are so many options when you're considering breast augmentation. There's 4 different incisions we can make. Most commonly, I make an incision in the inframammary fold underneath, in the crease underneath the breast. We can also make an incision in the armpit or the axillary approach. We can make an incision underneath the areola. Everybody knows what the nipple is. The areola is the tan part around the nipple. We can make an incision where the tan changes to the pale. And the 4th, less common incision is the umbilical approach. That's when an incision is made in the belly button, the umbilicus, and we make a tunnel. Usually it's a saline implant. We can wrap it up or round it up like a cigar and dissect into the subcutaneous pocket. That's not a typical approach. I should say that many of the breast implant manufacturers don't honor the warranty if that is done, mainly because it needs to be rolled up like a cigar and put in a metal tube. They feel that the implant can be damaged. In any case, as I said, there are many different incisions, 4 different incisions. We can go under the muscle, we can go over the muscle, we can have round, we can have teardrop shape, we can have smooth, we can have textured. And of course, the big decision, there are 2 big decisions for you to make when considering breast augmentation surgery, and that's silicone or saline. They each have pros and cons, and then there's roughly what size you want to be. Now, the myriad of possible side effects and complications that can occur. Implants can be felt. They can oftentimes be seen. There can be infection, extrusion, migration, a change in nipple sensation. You need to do special surveillance. You need to do self-breast exams. You may need an MRI in a few years after having silicone implants to monitor the breast implants. And perhaps the single most common complication or side effect with breast implants is capsular contracture. That phrase requires some explanation and teaching, of course. First of all, anytime we implant a foreign material into the body, regardless of what it is, a heart valve, a shunt, an artificial joint, a total knee replacement, breast implant, a hernia patch, anytime we put a foreign material into the body forms a scar around that implant. And that's normal, natural, healthy. It's just the way the body treats a foreign material that's inside the tissue. Not all foreign materials can be tolerated. Throughout the years, for things like cleft palate or breast implants or hernia patches, there have been so many different types of foreign material tried. And the body doesn't tolerate many foreign materials. It usually sort of pushes them out. You're very aware, most of you, if you get a wood sliver in your fingertip or a carpenter gets a significant piece of wood in the palm, oftentimes the body will sort of work it out. It'll try to push the wood out. And that can be a difficult process, but that can happen with any foreign material. Silicone, which makes up the shell for either a saline implant or a silicone implant, is very well tolerated by the body. It's really quite remarkable when you consider that we're putting a foreign material inside the body and the body doesn't really reject it or try to push it out. That can happen, but it's uncommon. So, as I said, anytime we put any foreign material in the body, such as a breast implant, the body makes a scar around that. And we call that a normal capsule. It's a normal scar, and we call that a grade 1 capsule. Well, what happens with capsular contracture? With capsular contracture, that normal scar tissue around an implant will start to squeeze, contract, get thicker and heavier, and with time can actually get calcified. It's the body's reaction to chronic inflammation. You may have heard about things like calcific tendinosis or hypertrophic ectopic calcinosis. That's when chronic inflammation leads to the body laying down calcium, and that can happen with capsular contracture. So a grade 2 capsule is one where the breast looks normal, but on exam it feels firm. A grade 3 capsular contracture is when you can look at a pair of breasts or a bosom or a set of breasts and you see a difference. In other words, you can tell that there's a little bit of distortion or increase in the kind of round projection or round nature of the implant. That's a grade 3 capsular contracture. And grade 4 is when there are constitutional symptoms. In other words, in maybe cold or damp weather, a woman feels uncomfortable with the breast implant. She may, when she goes on a plane and there's an altitude change, she kind of feels a tighter squeezing feeling. And in very rare circumstances, even when she's not out in the cold or when she's not flying in high altitude, she just feels a kind of a discomforting kind of tightness in the breast. That's grade 4 capsular contracture. Now, let me back up for a moment. For a grade 2 or grade 3 capsular contracture, that's not always objectionable at all. Some women actually prefer or like that sort of high, hard look, especially in bathing suits or certain clothing. Instead of having a push-up bra where they like their breasts to be high and quite prominent, high and hard and large, they don't need a kind of push-up bra. Just that capsule kind of gives that certain effect, especially in thin women, and especially when the implants are above the muscle instead of being under the pectoralis muscle. So a capsular contracture is not in and of itself problematic. It's not going to hurt you. It's not going to kill you. But some women are bothered by it. Now, what's the cause of capsular contracture? First of all, I want to emphasize that we don't really have a definitive answer to what causes capsular contracture. And hence, you're going to hear me say later on, we don't have a definitive cure for capsular contracture, but we certainly have some treatments. So, what's the cause of capsular contracture? Well, we certainly have an idea that it's chronic inflammation of some degree. The old silicone breast implants, almost all of them, used to demonstrate something called silicone gel bleed. What does that mean? Well, if we took a breast implant right out of the box, fresh, new from the manufacturer, it's sterile, and if we put it on, let's say a sterile paper towel or a white gauze or a surgical towel in the operating room, and then we, a minute or two later, picked up the breast implant, there would normally be a little footprint left. There would be a very fine, it's not really an oil, but there would be silicone gel bleed. The silicone was so thin, and it would, by osmosis, by osmotic pressure, transgress across that silicone shell, and there would be a little bit of silicone gel bleed. The newer implants, that doesn't happen. They're called cohesive. The gel, the silicone inside them is cohesive. It has a high cohesive value. We have photographs whereby you can take a scissor, surgical scissors or knife, scalpel, cut across the breast implant shell, and the silicone gel doesn't run everywhere. It just stays. So, and the shell itself is much less likely to allow the silicone gel to, by osmotic pressure, to go across that shell. So the newer implants, silicone implants, are much more durable, and they last a lot longer. Now, capsular contracture is chronic inflammation where the body's normal natural scar tissue starts to thicken and squeeze and contract. It doesn't really affect the breast implant. It's not the breast implant getting hard, it's the capsule, it's the scar squeezing it that makes it sort of seem hard and distorted. So what causes the chronic inflammation? Well, if the old silicone gel implant has ever showed some sign of bleed or leak, or if a silicone implant ruptures and there's gross spillage of silicone into the normal capsule, that can incite an inflammatory process whereby the capsule thickens and contracts and may eventually calcify if it's ignored or not changed out. The other way that we're quite confident can be involved with certain types of capsular contracture is the phenomena occurring in the body called a biofilm. This is going to need a little bit of explanation. A biofilm is the layer that bacteria can make and form to guard itself against the body's defenses to eliminate the bacteria. And there can be a little battle, there can be some chronic inflammation at that site where the bacteria around the breast implant are trying to wall themselves off and prevent the body's invaders, prevent the immune system from attacking those bacteria and eliminating them. Now, I want to emphasize something, that if a woman gets a capsular contracture, it doesn't mean there's an infection. It can be a low-grade colonization. In other words, there are bacteria on the silicone implant, and the body will likely try to eliminate those bacteria, but bacteria, since they're an organism, they'll try to survive, and they will sort of assemble some walls of defense. That's called a biofilm. Consider going hiking down at Sobrani's in Big Sur, or many other wonderful parts in this great country of ours, in national parks, etc. You may come across a mountain stream where the water is crystal clear, and you would have no problem, you would have no misgivings about drinking that water, because it may not be sterile, but it's very crystal clear, very clean. However, there is a biofilm in that stream. If you were to look at the rocks on the bottom of that stream, and you take a piece of wood, like a tongue depressor or a popsicle stick, and you were to scrape that stone or that rock on the bottom of the crystal clear stream, you know that it's likely that there's algae and some bacteria, and there are many thousands, hundreds of thousands, millions of germs and microbes on that rock, just underneath that crystal clear water. It's very similar to a biofilm. Now, certainly it's not as dramatic with a breast implant. You don't see that, certainly, you don't see that sort of slime or green on the breast implant, but there can be just a few very thin layer of bacteria on that breast implant. Now, how do they get there? You need to remember that the nipple is where the ducts lead to from inside the breast, for the lobules. So the breast is really a very complicated, sophisticated sweat gland, so to speak. It's a mammary gland. It's built to generate milk and lactate, etc. Now, in everyone, 100% of the population, those ducts are not sterile. They communicate with the skin. It's like a sweat gland or oil gland, sebaceous gland, or a hair follicle. Our skin is not sterile. It's normal, natural, probably healthy. We all have staph bacteria on the skin. It's only when those staph get out of hand or get inside a cut or get very aggressive or contaminate a wound where there's a problem that can lead to infection. But we all have staph on our skin. The ducts that lead to the nipple have bacteria in them, and they can communicate with the breast implant, and the bacteria can traverse or migrate from the ducts, those lobules, onto the breast implant, and then they can multiply. Because it's a foreign material, they have ways of guarding themselves and isolating themselves from the body's defenses. And of course, the bacteria within the ducts don't get to be a problem unless you were to develop something like a mastitis or a breast infection, whether or not you have a breast implant. So those ducts are not sterile. It can communicate with the breast implant, and then those bacteria can form a wall. They put up this wall of defense, and that can lead to a biofilm, which can lead to capsular contracture, which leads me to my next topic of discussion, and that's choosing the site for the breast implant. There's pros and cons of going above the muscle and below the muscle, but certainly one of the possible downsides to going above the muscle is that you're essentially going under the breast tissue, which can have some active ducts, which can lead to bacteria traversing or migrating from the ducts onto the breast implant, and then capsular contracture can occur if there's a biofilm. That doesn't mean that everyone should get their breast implants placed under the muscle. It's just one consideration. In fact, when I see a woman who has breast implants above the muscle, and she's got a severe capsular contracture that's bothering her, one of the things we can offer is a site change operation. That's when I take out the capsule, I can reposition the implant to a position underneath the muscle, therefore isolated from the ducts and more isolated from the bacteria that can, the staph that can come out of the ducts. That's just one option for a woman who really needs her capsules removed, really is bothered by capsular contracture. What are some of the other strategies we can do? You should be familiar with the term capsulectomy. Capsulectomy is what we do when we open up, usually through the same old incision or an inframammary fold incision, and we take out the capsule. That's called a capsulectomy. A capsulotomy, an open capsulotomy, is where we make the incision and we divide the capsule. A closed capsulotomy, I would say these days is performed in only very limited circumstances when we hold a long discussion, a complete discussion with the woman. That's when we do forceful massage externally. No incision is made, but we can kind of break up the capsule, break up that scar tissue from the outside. That's called a closed capsulotomy. And an internal open capsulotomy is where we make an incision and visualize the capsule and divide it and open it up. Capsulectomy is when we take the capsule out. I talked about a site change operation. That's when we move the position of an implant, typically from above the muscle to below the muscle, in an attempt to add another barrier in between the ducts and the breast tissue and sort of kind of provide more soft tissue coverage over the breast implant to isolate it from the more superficial tissue. When do I recommend to a woman that her breast implants are changed or she should really undergo a capsulectomy? First of all, in my practice, if I see a woman who has leaking silicone breast implants, I recommend to her that she has the implants removed. She can have an exchange if she wants. We can do a capsulectomy. We remove any silicone we can see or feel. I think it's better for the health of the breast tissue if a woman has documented leaking of silicone implants that she have the implants removed and undergo a capsulectomy. Now, there's no evidence, and we can say definitively, that silicone does not cause rheumatoid arthritis or lupus. It does not cause autoimmune disease. However, I think if there's free silicone, the breast tissue starts to sponge it up. It starts to soak it up and isolate it. That can lead to lumps called siliconomas. It eventually migrates to the armpit, to the lymph nodes in the armpit, and that can be hard to examine a woman. She can be misled or confused about what's a breast lump, what's a siliconoma. It makes mammograms more difficult. More women may get MRIs because of the leaking silicone, etc. Certainly doesn't cause cancer. In fact, probably women with breast implants, because they have smaller breasts, because they have less breast tissue, they may get less breast cancer. But it's just not good for the health of the breast tissue, in my opinion, and I think a lot of plastic surgeons agree with me. There's kind of a debate with breast radiologists when the silicone is limited to being in the capsule. They'll say, well, there's no evidence that your silicone has migrated outside of the capsule or regressed outside of the capsule yet. Well, that's a big word, yet. My advice to these women is schedule a capsulectomy and have the implants exchanged or removed before you give it a chance to egress and get outside the capsule. I think to wait until there's evidence that the silicone is outside the capsule, I don't think you're doing yourself any favor. I think that leaking silicone should be removed. So if there's leaking silicone, I recommend a capsulectomy, implant exchange. If you don't want new implants put in, you don't have to have them. You can have a breast lift if you want. That's a mastopexy. You can get converted to a saline implant. We can do that for you, whatever you'd like. But I do think it is medically necessary for a capsulectomy to be performed, all free silicone that we can see or feel be removed, and the old leaking implants be removed, and you can have new ones put back in that are much more durable. Now, what about capsular contracture around a saline implant? Keep in mind that the shell of a saline implant is just the same as a silicone implant. It's made of a firm silicone. A biofilm can occur. There can be capsular contracture, it can get contaminated, it can get colonized, but the inside of the silicone, of the saline implant is different than a silicone implant. In a silicone gel implant, the silicone shell is filled with a silicone gel. With a saline implant, the silicone shell is filled with salt water. That's what the filler is, saline. Now, you may have heard about something called the ideal implant. That's a combination. Actually, it's a saline implant that has these baffles in it. There are some implants which have silicone on the inside and saline on the outside. There's all variations that we can talk about in your consultation if you're interested in that, if you want an implant exchange, etc. But suffice to say that the shell is silicone, and inside there is either saline or saline with many baffles, the ideal implant, or silicone shell filled with silicone gel. If a capsular contracture occurs for you, of course, it should be categorized. We always want to know if there's a silicone gel leak. If you come in for a consultation, it's always good to bring your records. What size implant do you have in now? Are you above the muscle, under the muscle? Are you silicone, saline? What manufacturer is it, etc. Many of the manufacturers offer a warranty. You're probably familiar with the Dow Corning warranty. Now there's different manufacturers of breast implants, and they have different warranties. So if you have a leaking saline or silicone breast implant, it may be covered by a warranty. But in any case, if you have a capsular contracture, you should know that it can be categorized from grade 1, 2, 3, and 4. It's not absolutely medically necessary that it's changed. My recommendation is if you have a leaking silicone implant that they do be removed. And of course, we can do a capsulectomy, we can do a capsulotomy, open or closed, we can do an implant exchange. You can have a breast lift if you want, you can change your size, etc. So the sky's the limit based on your desires, your health, what you want done, what your expectations are, and we can make a custom designed approach on your photographs, your physical exam, your mammogram results, etc. If you'd like any more information on hard breast implants, capsular contracture, or any procedure regarding the breast or plastic surgery, I hope you'll call my office. I'm Dr. David Morwood. I'm on the Central Coast in California in beautiful Monterey. My office is 831-646-8661, or go to my website, drmorwood.com. That's DRMORWOOD, here in beautiful Monterey. Once again, this is the Doctor is in Television program. I'm Dr. David Morwood. I'm a board-certified plastic surgeon. I hope you'll stay with us. We're going to take a very brief pause for a very good cause. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. Here in California, we all love the outdoors. Golf, tennis, going to the beach. However, the sun can play havoc with the delicate skin on the back of the hands and neck. Call or click today to learn the newest methods for restoration and beautification of the hands, neck, and other areas affected by the sun. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. One of the common goals I share with my patients is that they look natural after their facial rejuvenation.
Dr. Morwood made me feel really comfortable. His staff is phenomenal. Going into his office is always a great experience.
Call or click today to learn how our combined approach of art and science can enhance your natural beauty. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. A smooth, firm neckline is a universal sign of beauty in both women and men.
Dr. Morwood not only helped me regain my confidence, he helped me achieve the best version of me.
Call or click today to learn how the natural neck lift can rejuvenate your beautiful neck and jawline.